In the spring of 2020, like many worldwide health services, the HSE was in a race to buy ventilators, frantically tracking down suppliers, many of them never dealt with before, to secure life-saving medical equipment. The manner it did so, the topic at today's Public Accounts Committee.
The HSE placed orders for a total of almost 3,500 ventilators at an agreed cost of €129 million. This was almost twice the number of devices that the HSE had been sanctioned to purchase.
Why order that many if the government had only sanctioned the purchase of 1,900?
The only way at that time to get ventilators was to order, was to pay in advance, and was to over-order, because orders were being gazumped continually.
But as it turned out, the HSE didn't need them either. An analysis of its surge capacity found it needed just 326, a fraction of the order. After some cancellations, 581 working ventilators were bought from reliable suppliers. 467 more came from largely unvetted ones in China, with a high failure rate and low compliance with European standards. The HSE is still chasing refunds for $22 million.
They're at various stages of being pursued, and they'll have to be pursued at different scales depending on the options available in the Chinese system.
Would you agree that there was a breakdown in command and control at the senior levels?
We took more financial and procurement risk in order to manage patient risk. We could just as easily be sitting here having an inquiry about why we didn't have enough ventilators.
The state spending watchdog says even in urgent circumstances, it's still possible to ensure good value for money for the taxpayer. The point of today's exercise to learn lessons for the next pandemic, whenever it may be. Gavan, Reilly, Virgin Media News, Leinster House.